On behalf of the Patient Safety Authority, I'd like to welcome you to this web conference titled Health Literacy Webinar Series, Webinar Number 1, Developing Written Education Materials. My name is Melanie Mott, and I'll be your moderator for this program. Now I'd like to introduce our speaker for the webinar, Jeffrey Bomboy, Patient Safety Liaison. Jeffrey is a Patient Safety Liaison with the Pennsylvania Patient Safety Authority, the Northeast region of Pennsylvania. Jeff has worked for the Patient Safety Authority as a Patient Safety Liaison since 2012. He interacts with patient safety officers and various other healthcare staff in 80 different healthcare facilities across northeastern Pennsylvania in an effort to decrease medical errors. He has facilitated a collaboration with 11 ambulatory surgical facilities located in the northeastern Pennsylvania in an effort to decrease unplanned transfers and cancellations. He's co-authored an advisory column detailing the collaboration. He authored an advisory column on unsafe injection practices and drug shortages in ASF that was published in December 2012. He also provides regional and site-specific educational programs in response to identified patient needs of the Pennsylvania healthcare facilities. He is a member of the Pennsylvania Health Literacy Coalition. Jeff, now I'll turn the program over to you.
Thank you, Mel. I'd like to welcome everyone to the first of a series of 4 webinars discussing health literacy. Additional webinars will be held in April, July, and September discussing other topics in health literacy. You can see our objectives today are to define health literacy, look at the scope of the problem, identify some barriers, and provide some strategies to improve health literacy. So what is health literacy? Well, health literacy is the ability to read, understand, and act on health information. A person can have completed the required number of years of school and still have limited health literacy, and we'll talk about what that means. In fact, approximately 45% of high school graduates have limited health literacy. Health literacy requires knowledge from many topic areas, including the body, healthy behaviors, and the workings of the health system. Health literacy is influenced by the language we speak, our ability to communicate clearly and listen carefully, our age, socioeconomic status, cultural background, past experiences, cognitive abilities, and mental health. Another important factor in health literacy is numeracy. And numeracy is defined as the ability to reason and apply simple numerical concepts. Concepts consist of comprehending fundamental mathematics like addition, subtraction, multiplication, and division. And this is especially important when dosing medications, calculating special diets such as diabetic diets and low sodium diets, etc. So our patients have the right to really understand what we're talking to them about so they can make appropriate decisions. And the interactions between laypersons and professionals really influence the health literacy of the individuals that we're dealing with in society as a whole. So we should use a universal approach. And as we all know, we use a universal approach in infection control, assuming that anyone could potentially have an infection until we prove otherwise. So we can do the same thing with health literacy. You cannot tell someone's literacy level just by looking at them. A person may present themselves well, speak well, and appear to understand what is going on. However, this does not mean they truly do understand. In terms of health literacy, universal precautions means to assume each patient has a low level of health literacy and err on the side of caution in making clear communications in plain language standard practice in all patient encounters. Language used in the health field is not commonly used in everyday language for most people, and even those with good educational backgrounds may not understand what their diagnosis means or what is being asked of them. So even someone that normally manages health information well may have an increased difficulty under certain circumstances. When they're feeling anxious or overwhelmed by too much information or illness, they may fail to understand the information we're giving them. So at the end of the day, it's best to use simple, clear language to avoid any opportunity for misunderstanding. So according to the literature, there are 4 levels of health literacy, and the levels are proficient, intermediate, basic, and below basic. And in proficient, someone can demonstrate proficiency associated with long and complex documents and text, such as understanding their health insurance, their copays, their deductibles, what their plan covers. It really takes a proficient level of literacy to truly understand that. Whereas intermediate They can integrate information from long and dense text, determine appropriate arithmetic operations, understand diet instructions, dosing changes, etc. With the basics literacy skills, you can really locate information in text but make only low-level inferences and integrate easily identifiable pieces of information. You can't really analyze the information and understand it. And in below basic, you can perform only uncomplicated tasks such as looking at text and documents and only really be able to locate a piece of information in a news story. So you can see that there's wide disparity in the levels of literacy. The majority of adults, 53%, have intermediate health literacy, 12% have proficient, and then 36% have basic or below basic health literacy. So that's really important to understand that 30% of our population really has difficulty understanding what we're talking to them about. And when you talk about patients who are age 65 and older, they even have a lower average health literacy than adults in the younger age groups. And as we know, in Pennsylvania, we deal with a high elderly population, so we need to keep that in mind. You can see on the chart, the purple and the blue are your below basic and your basic. So again, that's 36% of the population in that area. And it includes 93 million adults in the United States alone that have basic or below basic skills. So let's look at the extent of the literacy problem. Education level and income does not necessarily indicate health literacy. Even highly educated, high-income individuals may not understand healthcare issues and how to maneuver through the system. We as providers take it for granted that these patients know what to do. I gave a presentation on health literacy not long ago to a group of physicians, and the one physician got up and said, yeah, this is very true. He says, my friend who has a doctorate in economics was having some problems with his kidneys. And he went to the doctor to get them treated, and he didn't even understand that he had 2 kidneys. So there's someone with a doctorate degree teaching in a college that truly just doesn't understand the medical issues and his anatomy and physiology. So it really doesn't matter what your income is, what your employment status is, or your education level. You can still have problems with health literacy. So what do we know from a decade of research? Well, those with poor literacy skills have trouble navigating the healthcare system, obtaining, understanding, and using their health insurance plans appropriately, reading, understanding, and acting correctly on medical instructions, and taking their medications as prescribed. Hence, those with poor literacy skills are not receiving quality health care and typically overuse high-cost healthcare venues such as emergency rooms and hospitals. They're also frequently rehospitalized for failure to correctly follow discharge and aftercare instructions. And what we are so quick to say in the healthcare industry is that these patients are non-compliant because they haven't followed our instructions. But perhaps there's a deeper reason for that in the fact that they don't understand what we have told them. They don't understand what we're saying to them. And so we need to improve on that for them. But we're going to learn about some red flags today and techniques to improve understanding. And we can improve health status and understanding if we use some of these techniques that we're going to talk about. Here's a saying from George Bernard Shaw that really is quite appropriate. It says the single biggest problem in communication is the illusion that it has occurred. As we know in healthcare, many errors occur because of communication issues, and they can occur with our patients when they don't understand what we're saying as well. So you got to understand that poor readers don't understand what we're saying when they're reading the material that we give them. And that's why we're going to talk about designing written material in a better fashion today. But what we have to remember is that we are writing for our readers, not for ourselves. Creating and using printed materials that is written at a reading level no higher than 3rd to 5th grade level is essential. Some studies say 4th to 6th grade level, but as you can see, it's a low level. However, most patient educational materials that are in our facilities today are written at an 8th to 12th grade reading level. And if poor readers can't figure out what the message is quickly, they'll lose interest. They may not feel it's worth the effort to even try to understand the material that we give them. There are several tests that are available to judge the grade level of written documents, and we'll discuss these later in the program. We also have to remember when we're talking about older adults, and again, we have many of those in Pennsylvania, that as many as 2/3 of adults with vision problems are older than 65, so we need to also take that into account when we're designing our written materials. So when we design written materials, we need to make the purpose and usefulness of the material immediately obvious. Use the title or other upfront text to make it clear to readers what the material is about, who it is for, and how to use it. And remember that readers skim and make quick judgments about what's worth reading. Material that we're developing is created to educate people, typically typically focuses on what we want them to know. It is producer-centered perspective rather than reader-centered perspective. It reflects our hope that once they know what we want them to know, they will do what we want them to do. But the simple act of giving people information, even when people understand and accept it, does not automatically move them to action. Because again, we're writing for ourselves, we're not writing for them. So instead of focusing on what you want your readers to know, try focusing on what you want them to do. This shift in perspective will encourage you to look at things from the reader's vantage point and take account of what might motivate your readers to take the action you're seeking. Taking a reader-centered approach means finding ways to make the material of interest and value to them. We're going to talk about plain language. So what is plain language? Well, plain language is language that the average person can understand. It's clear, it's common, it's simple. It's the language that your mom and dad or brother and sister that aren't medically inclined use when they're sitting on the sofa at night chatting or chatting over the dinner table. It's not medical jargon. It's not complex terms. It's everyday language, what we can call living room language. And basically, plain language includes defining your audience. That's important. We'll talk about that more. So that you give them the information they want and need to know, not what you want them to know, but what they need to know. And it's very important to test your materials to ensure the audience understands, and we'll talk about that a little bit more. So what are some examples of plain language? Well, right here are terms that we would typically speak in terms of, like annually, arthritis, cardiovascular, diabetes, hypertension. But do our patients really understand that? Is it not better, instead of saying you have a cardiovascular problem, saying you have a problem with your heart? Or we're going to send you to a dermatologist. Let's tell them we're sending them to a skin doctor. And we commonly use the term hypertension instead of high blood pressure, and people don't always understand what that means. There are some documents available through the CDC, and you can see the website at the bottom there, for word substitutions, everyday words for public health communication. This can be helpful when you're designing your written material so that you can be speaking in plain language rather than medical jargon, because sometimes we don't even realize the words that we're using. The Canadian Public Health Association came up with a manual. It's called Easy Does It Training Manual. And it talks about using plain language, and that you should put a lid on it when using plain language. In other words, pay attention to the language you use, using simple language or plain language. Pay attention to the organization and amount of information you present, because if we overwhelm our patients with too much information all at once, they're not going to retain that information and be able to use it. And we got to pay attention to the design of our text and graphics, and we're going to talk about that a bit more. The Canadian Public Health Association also designed what's called a plain language grid. It looks at grade level, relevance, interest, and design. And on the next couple of slides, if you answer to more than 3 of these questions on the next 4 slides, know that many of the adults with low literacy skills may find the material difficult to read. Now remember, we have approximately 93 million patients in the United States that have low literacy skills. So is your information written at a grade 4 to 6 level? if it's written at a higher level than that, many people will have difficulty understanding it. Is the information accurate, up to date, and complete? And how many times do we get information perhaps during a hospitalization or from a physician's office? You can tell it's been copied over and over and over again. It doesn't look good. You know that perhaps that information may not be up to date or accurate. So we need to continuously look at the information that we provide to patients to make sure that it is the most up-to-date information. We need to make sure that the information is what the client needs and wants to know. And also we need to be sensitive to their gender, sexual orientation, and culture. There are lots of cultures and subcultures in this country today, and we need to take into account that if you have a high population of Hispanic speaking patients, that you need to design your materials to be sensitive to their needs and their cultural and ethnic background. Also going on with the grid is the information written in a friendly and conversational style. It should be written as if you speak to a friend, not in a formal manner. Is the information organized? If it's not organized, it will be difficult for them to follow. And again, is the information written with plain words? And are important ideas repeated and summarized? And there's nothing wrong with repeating important topics in that written material so that they do understand it. The Safety Authority has developed some tools which can be found on our website to help you to evaluate your patient documents, and this is page 1 of 2 of our tool. It looks at your document. It talks about, do we have 2 simple key objectives? Because if we have too many objectives, they will not understand it. Do we describe the most important information first? It's always important to get the most important information first. Does it emphasize a desired behavior? Have we avoided medical jargon? Have we used plain language with 1 or 2 syllables? Have we used brief sentences of no more than 10 to 15 words and limited paragraphs to 3 to 5 sentences? Have we used the word must to indicate requirements? Are we using an active voice such as this blood test will tell us, blah, blah, blah? Have we used audience-appropriate images and diagrams? And so if you use this document to evaluate your written material, it will help you to decide whether it is really with the intent of the reader in mind. It goes on to page 2 to look at simple design with sharp contrast between text and paper. Remember that we have an elderly population, and if you're starting to use blue sheet with red text on it or red sheet with blue text on it, they're not going to be able to distinguish that very well. It's always best to use white with black text if at all possible. Use appropriate spacing, 1.5 to 1.5 line spacing, so it's easier to read. Leave a lot of white space, and by white space I mean that space that doesn't include print or visualizations. It's the space around words, around your pictures that you may have on your documents to make it more easy. During an ambulatory surgery facility collaboration, we talked a lot about designing pre-op and discharge instructions for patients, and I evaluated some of these, and I had a facility that they had 4 pages of 12 font, line after line after line of instructions for patients. And they were having problems with cancellations because patients weren't following their pre-op instructions. And we worked with them to redesign their written material, and they were able to redesign it, put it on actually it was put on fuchsia colored paper, but it did have black bold print, so it was easy enough to read. And it included 1 page, bullet pointed instructions that was much easier for the patients to understand, and they had a dramatic decrease in cancellations because of not following pre-op instructions. So we really need to pay attention to those sort of things. Again, look at leaving your right margin jagged, and we'll talk about that more, using a larger font for the elderly, and using a clear font style such as sans serif font that's like a Times New Roman. It's much easier to understand than some of the fancy fonts. So this form is meant to really assist you in evaluating your written material. There's also a log available also on our website with these documents that will help you keep track of when you have last reviewed your written material to see if it needs to be amended or not. So some tools out there that are already there to help you in evaluating your written material. So let's look at some planning steps for written materials. Again, as I said before, you want to define and involve your audience. You want to develop your material. Then you want to test it on the audience that you're intending it for, because they can tell you whether it's understandable or not. That's another thing, our collaboration with ambulatory surgery facilities, some of the facilities. I said, take your instructions home. Give it to mom or dad who are not medically inclined. See if they can understand it. If they can't, then you need to look at perhaps revising it. You need to take into account age, gender, and culture, literacy levels, what learning theories apply. Do you want to use text? Do you want to use visuals? Do you want to use a Q&A format or stories? What works best for this population? Groups may have different needs, values, and beliefs that will affect how they interpret your message. Minority groups often have subgroups, so you need to keep that in mind. And so that being said, that's why it's so important to include your clients in planning and writing of this material. As I said before, in our check sheet that we designed, you want to limit your objectives and message. You want to give minimum educational objectives. If you give them 10 objectives, they're not going to remember probably the last 5 or 6. You want to list topics that must be included in the material. And you want to remember to use the least amount of material that you can give them that still gives them the information that you intend them to understand and do. Okay? We want them to be able to change a behavior or perform a procedure, but we don't want to overwhelm them with information. In the writing and production phases, we want to select the format. Again, as I said, do we want to write a description? Do we want to write a story? Do we want to put it in Q&A format? Should we include some interaction? Because when you include interaction, sometimes it will absorb better for the reader. And if you have to use words or phrases that are not plain language, make sure you explain them and give examples. Again, test the draft and final with a few clients. Use a checklist. Use readability tests and suitability assessment of materials to try to evaluate this. And we're going to talk more about that in just a moment. And then you want to document your assessment results and go back to your group that's developing the material. So let's look at suitability assessment of materials, otherwise known as SAM. What this does is it provides you a way to determine if the written material is suitable for the audience that you intended it to. Okay, it guides you in rating the materials on factors that affect readability and comprehension. It looks at content. It looks at literacy demand, graphics, layout and type, learning stimulation and motivation, and cultural appropriateness. When you just need to keep in mind, though, as far as literacy demand, when using grade level score as a sole source of criterion or summary indicator, it can mislead you into thinking your materials are suitable for individuals with low literacy, when in fact they may not be. Short sentence length and shorter words are an important factor, but familiarity with the words and the reader's familiarity with the topic are also important, so it's not just about simple words. This is an example of that. These both, using the SAM tool, would have the same readability score, but which one seems to be easier to understand? Write down your first name, now put down your middle initial and your last name, and fill in your age on the next line. That's pretty simple, and it scores the same as this other account here. Enter your gross annual income, add all your assets and real estate stocks and bonds, and figure your tax from the table. That certainly is not easy to understand compared to the first example, but they have the same readability score. So you need to keep that in mind when you're using readability scores. If you think the reading level of your document is too high because of long names or organizations, diseases, other proper nouns, you can use a readability formula without those words. Okay, and it may be that the readability is at the right level except for the long words. If this is the case, revise your text to remove the longer words. If you then find the reading level is still too high, even when you don't count the long words, write in plain language or use everyday language that people most likely can understand. One of the best ways to see how a plain language approach can improve a document is to look at examples of the document before and after they were edited into plain language. And you can see a number of readability formulas here, the Flesch Kincaid, the Smog, the Fry, so on and so forth. Again, they're tools to help you, but you can't rely completely on those. The government has a website. It's www.plainlanguage.gov/examples/before_after. And it helps you to look at examples of before and after and see how much easier it makes it to read a document. Again, these tools should be as occasional use, not as your overall suitability. You want to use readability formulas as a tool for identifying long words and long sentences that may be too difficult for your intended readers. You don't use a score for reading grade level as your only indicator of difficulty or as a measure of comprehension, keeping in mind that readability formulas only measure the length of individual words and sentences, but don't use them as a summary indicator as your sole or final standard for judging suitability of materials. When you need to reduce reading difficulties for your materials, use readability formulas in combination with other toolkit guidelines. And if you look on cms.gov, you'll find a document called Toolkit for Making Written Material Clear and Effective. It's an 11-part document that does exactly that. It helps you to write clearer for your written material. I found it very useful when I reviewed that document. Again, you need to explain the purpose and limit content, and we'll look at some examples of that. You need to make the usefulness and purpose of the material immediately obvious, or people that are poor readers will lose interest, and you need to emphasize desired actions and behaviors. So this is an example. The poster I was not able to copy and paste onto this slide. It was a poster made by the Medicaid program, in its resources for pregnant teenagers, and the first print on that poster was "Pregnant? Now what?" And then the subtitle was "Give Your Baby a Healthy Start. One call gets you connected to care." Very effective wording in drawing someone's eyes to what the poster was about and what it was going to help them to do. So again, choose your words and your phrases carefully to capture the interest of the intended readers. You want to draw the readers in. So here's some more examples of using words carefully. This was a program that was being developed to help seniors understand their medications, and the original title was "What Every Senior Should Know, a Workshop on Drugs." Well, that doesn't really identify what they were talking about with drugs. Are they talking about illicit drug use? Or are they talking about everyday prescription drug use and over-the-counter drug use? It didn't really specify that. They then changed it to say medication errors in you, a workshop for people with Medicare. Well, that was a little more defined, but does the average elderly person understand what a medication error is? That's a healthcare jargon. That's the term that we use in healthcare. So they may not really understand it, and will it attract them? Then they finally came up with the title below, Tips for Keeping Track of Your Medications and Using Them Safely, a free program for older adults presented by Springfield Agency on Aging. So a couple of good things about this. First, it gave a clear message as to what you were trying to portray. It called it a program rather than a workshop, because a workshop makes them think they might have to do some work. And then it also said who was presenting this program, and it was a well-known community agency that the audience members trusted. So it drew the audience in. They knew what they were coming for with this program. So again, it's all about choosing your words carefully. Bulleted lists should have a subheading. The first bullet should be close to the subheading and leave space between bullets. And use solid colored shaped bullets and keep your bullets simple. And then, as I talked to before about white space, leave extra white space between your previous subheading and the next subheading. And you can see that in this slide, the white space I left after the subheadings between your next subheading. It makes it much easier to read if you leave some white space. People that are in graphic design say 10 to 30% of your page should be white space, again, making it easier to follow and read. This is another example of an easy-to-read material. A healthy mouth for your baby, okay? It then lists by bullet point or numerically what topics are going to be covered in this brochure. And then on each page, it will list number 2, check and clean your baby's teeth, and it goes over the material there and how to do what they would like you to do as far as your baby's teeth. So again, choosing words carefully, bullet points are good. Some things to remember for older adults and with vision challenges or poor readers. You need to make your design simple and sharp contrast. Again, black text on white is always good. Use a larger font size for your older adults. At least 2 font sizes larger than your main text for headings, and use 1-inch margins. And again, leave white space. Spacing between lines should be at least 25% of the font size. Use a non-glare paper, because as you know, when you're looking at glare paper under the lights, it's very difficult to read. Reduce the amount of text. Don't overwhelm them with a full page of 12 font text. They won't be able to read it and understand it. And if you're using tables, certainly make it simple and easy to follow. Some more examples of how to properly set up columns and justification. The sample on the left, it says this column does not have right justified margin. The spaces between words are even. The jagged right edge also makes it easier to distinguish one line from the others. This is how we're used to reading in books or in newspapers. As opposed to sample 2, the column has right justified margins. The spaces between the words are uneven. The lines are all the same length. And this can confuse readers, especially unskilled readers, and make it harder to differentiate one line from the other. So sample 1 is an example of what you want to do. Sample 2 does not make it easy to read. Column length has something to do with easeability of reading also. The column at the top is only 20 and 25 characters. You can see your eyes need to jump back and forth frequently to read the entire column, as opposed to a column that is 40 to 50 characters long. Your eyes can return to the beginning of the next line easily, doesn't jump back and forth. So that is how you want to design your material, not 20 and 25 character columns, but 40 to 50 column, or 40 to 50 characters long. So again, you want to make your written material action-oriented. You want to tell them why actions are needed. So something such as using an active voice saying, take this medicine with food, is certainly better than saying the medicine should be taken with food, because it's an active voice saying, take this medicine with food. Another example will be elevate your feet. It's telling them what to do in an active voice rather than your feet should be elevated. It's just a little change in wording, but it makes it much easier. And use conversational style sentences, as I had mentioned before. For example, when you're talking or writing material, use the word doctor rather than physician, because it's more conversational and easier to understand. Some more examples of writing an active voice. Here's a sentence: food can be kept safe by always washing hands before food handling. It's a little cumbersome, a little bit difficult to understand. So why don't we rephrase that and say, wash your hands before handling food to keep food safe. Says the same thing, but in a different way and much easier to understand. Here's another example. No single food can supply all the nutrients in the amounts needed. For example, milk contains calcium but little iron. Meat supplies iron but little calcium. A nutritious diet consists of a variety of foods. Very difficult to understand for the average person, so why don't we rephrase that to say, eat a variety of foods such as milk, meat, and vegetables and fruit for a healthy diet. Much easier to understand than the first example. Using concept words, keep your glucose level within normal range. Well, what does that really mean? You need to add an example to clarify that. So what you would say is this means to keep your blood sugar somewhere between 70 and 120. This is a range of sugar numbers that means your blood sugar is normal, that it's okay. Again, plain language, your blood sugar, range of sugar numbers using plain language. You want to make sure if you're using words such as heavy, regularly, or excessive, clarify what you mean by them because different readers read them differently. An example of that would be if you note poor workers, well, does that mean workers that have poor performance or workers with limited income? And using words such as heavy and regularly can have you can denote that they don't understand what that might mean either. Visual presentations. Visual presentations can be really helpful for those that are poor readers. Poor readers rely on pictures and oftentimes spoken words rather than reading the information to get what they need to know. So we're going to look at some examples of some visual presentations. On the left is an example from the CDC of how to wash your hands. And even if someone isn't able to read the print very well, they can see the illustration as to how the proper way to wash your hands is and probably do it more correctly than just giving them a sheet with written instructions on. Another example on the right side is from the CDC as well. It talks about an E. coli outbreak and how you can get sick from eating raw spinach. The top picture shows the girl that's not feeling well after she ate her unwashed spinach. That it affects the young and the elderly more in picture 2. That if you ate raw spinach more than 5 days ago and you're not sick, then you don't need to see your doctor. That's the gentleman that looks healthy. And that if you touch raw spinach, you should wash your hands in hot soapy water. So again, it's the pictorial, the visualizations, as well as the print that helps someone with poor reading skills to understand. I really like this example. This is how to fit your bicycle helmet, okay? And if you can remember the 2V1, you'll remember even without looking at this diagram how to fit your helmet. 2 fingers above your eyebrows for the front of the helmet, a V-shaped strap under your ears, and 1 finger space under your chin strap. So 2V1, really, really easy to remember and understand. And again, they're using an active voice. They're saying, wear your helmet every time you ride your bicycle, instead of do not ride your bicycle without wearing your helmet. It's reinforcing the positive. It's highlighting the positive. Wear your helmet every time you ride. As far as using visuals effectively, photographs work best for showing real-life events, people, and emotions. They tend to be more compelling to audiences, but there's nothing wrong with illustrations. Illustrations sometimes work better for complex issues, such as showing a procedure such as drawing blood, explaining an invisible or hard-to-see event such as airborne transmission of tuberculosis. So sometimes illustrations are better than photographs. Simple drawings are very good. I know that my dad a few years ago was having some problems with his legs, and when we took him to the vascular surgeon, in his office are these very complex anatomical drawings of all the blood vessels in your legs that not many people are going to understand. So the surgeon took a blank piece of paper and he drew a very simple picture of the arteries in my dad's legs and showed him where the blockages were and what he was going to do to fix them. And my dad could understand that much more easily than those complex anatomical drawings on the walls of the doctor's offices. So a lot of times physicians do a really good job with using those simple hand-drawn pictures that they use when they're explaining things to patients. So certainly encourage that. I like this example. This is an example of an appointment card. And sometimes people can't understand a typical appointment card because there's writing on it and they just don't read it well. So this shows a picture of a clock so you can draw the hands on for 3:30, that the appointment is on the 8th, showing it on a calendar on the 8th with Dr. Casey. Really easy example of how to understand an appointment, return appointment to the doctor by using a visualization rather than just writing it out. So to recap, plain language is not alone enough. Readers need time to absorb new information. Repetition helps them remember it. Too much text can be overwhelming, especially to less skilled readers. If material is too long, consider other ways to package it. If you condense it, remember, don't oversimplify it or drop examples of what the readers really need to know. Make it easy for your intended readers to figure out both what is covered in your written material and what you're supposed to do with it. And if the content and purpose are not evident from the title and other prominent text, many people you're trying to reach won't give the material a second glance. So pay careful attention to how the title and other prominent text will shape your reader's impressions. The title, subtitle, and other upfront text are your first and best chance to attract the reader's attention, and so make it informative and appealing. And again, pay attention to your intended audience because you need to test it out on them. Number of references that we used for this presentation, you can see. And now we will turn the program back over to Mel for any questions you might have.
Thanks, Jeff. That was a very informative presentation that contains valuable information everyone can use in their organization. That concludes our slide presentation portion of our program. Now we would like to begin our question and answer period. If you have questions, please type them in the Q&A box found on the right-hand side panel of your screen and direct them to all panelists, and we will try to answer as many questions as we can. Okay, Jeff, we have one question here. Where can we find SAM tool and other readability test tools?
Yeah, they can easily be found by doing an internet search. Keep in mind, if you just put SAM in the search box, you're probably going to come up with Sam's Club rather than Suitability Assessment of Material. So you might want to put actually Suitability Assessment of Material in your search box. If you just put in readability test tools for literacy, it will come up with all of the different tools that are available out there that I discussed on the one slide. So they are readily available on the internet for anyone's use.
Great, thank you. Okay, we do have a comment that came in. It says here, in reference for the 4th to 6th grade reading levels for health literacy, Medicaid managed care organizations are required to write between 4th and 6th grade levels determined by each state.
Okay, and that's depending on the literature you look at, and you can see that there were variations in some of my slides. Some mentioned the 3rd to 5th grade level, others a 4th to 6th grade level. Just keep in mind that you want to keep it at more of a grade school level than a high school level when designing your material for those that have difficulty reading and understanding. A good comment.
And we have another question here. Where, again, are the Safety Authority Health Literacy tools located?
Okay, if you go onto our website, patientsafetyauthority.org, there are tabs along the left-hand side. One tab says Educational Tools. If you click on that and then click on Health Literacy, you'll find the tools that were in my slide presentation available there, as well as the log to keep track of what documents you've already reviewed in your facility. So they're all available for your use on our website, and we encourage you to try to use them to make your material more readable for your patients.
All right, we have another question. Can you repeat the title of the toolkit for using readability formulas?
Okay, there are a number of tools out there. Let me see if I can go back to that slide, perhaps. These are different programs that are out there available. Again, if you do a search on the internet for those, look on Flesch-Kincaid, SMOG, it's a simple measure of gobbledygook. The Fry, the PMOS, iKirsch document readability formulas. They're all different materials for looking at assessing your suitability. Not one is perhaps better than the other. And again, as I noted before, you want to use those as just part of your evaluation, not perhaps your entire evaluation of your written material, but that's a good starting point.
Great, thank you, Jeff. Okay, we have another good question here. Is there anything out there to check the readability of foreign language documents?
That's a very good question. I would have to do some research on that and perhaps get back to them on that. I have not looked for it myself, and I do not know. So we'll have to get back to you all on that.
Let's see, I think we have another question here. at around slide 32, 33, you referenced a website. Can you provide that website again?
That may have been the cms.gov website in looking for the toolkit for making written material clear and effective. If you just go on cms.gov and look, do a search for toolkit for making written material clear and effective, I believe that may have been, there was another website I gave also. The other one was perhaps the one, it was www.plainlanguage.gov/examples/before_after, and that's looking to see if your document is more easy to read after you've used plain language. So there are a couple of websites that you can go on to find additional information.
Okay, and I think another question that came in leading into what you were just saying, are there any other good resources for health literacy?
Yeah, there's a lot of information on the internet. One site that I really like to use and has a really good toolkit is the Agency for Healthcare Research and Quality, or AHRQ. If you go on ahrq.org, or .org or .gov, and look up health literacy, there is a wealth of information on that website, including a toolkit which has been recently revised. There are slide presentations on there. There are examples of ways to make your information more easy to understand. Just a wealth of information on the AHRQ website. So that's one site I would highly recommend you looking at. And then the CDC has information on their website. CMS.gov has information on their website. So there are lots of sources out there for information if you're interested in looking further.
Okay, and we have a comment just to go back to somebody asked about checking the readability of a foreign language document. There's a comment here. There's a software program called Health Literacy Advisor that can evaluate Spanish language material.
Oh, great. I appreciate that input. Thank you very much.
Another comment, Ask Me 3 is phenomenal for teaching.
Yeah, that is a program from the National Patient Safety Foundation. It is a trademark tool, but the information on that is available for free on their website. There are posters, there are flyers, there are videos on the National Patient Safety Foundation website. And the Ask Me 3 program is basically once your patient asks 3 questions when they go to see a medical provider. What is my main problem? What must I do? And why is it important for me to do that? And if the patient understands the answer to those 3 questions, they typically will understand the importance of their health condition and the treatment that is required for it. Very good program. Again, lots and lots of material on National Patient Safety Foundation or npsf.org website. If you just queue Ask Me 3, you'll find lots of information on there.
Thank you, everyone. This concludes our webinar.